University of Zimbabwe. Unlike other institutions that you have presented, our implementation is slightly different. We have a totally dedicated server for the African Digital Health Repository. We totally decoupled it from our main institutional repository. The main reason being that we would want to take on board other institutions so that they can also contribute content to that repository. If we were going to put it on our University of Zimbabwe institutional repository, our fear was that, or is still that some institutions might be hesitant to contribute content, particularly other universities like the National University of Science and Technology. They are also offering some degrees in the medical arena. The same applies to Midland State University. So we wanted a neutral platform where other participants might be free to contribute their content, as well as other nursing training institutions. So we have a totally independent implementation of the repository. This is an overview of our presentation. We'll start with, in terms of policy, I think we thought of starting with our University of Zimbabwe institutional repository, which should be accessible on that particular URL. But for now, because we are having challenges with one of our internet service providers, we have 2 internet service providers in the that the University of Zimbabwe is using. So our institutional repository, as well as the African Digital Health Repository, is accessible through one of the internet service providers, which is currently down. So in terms of policy, we have the draft policies in place. It has been handed over to the University of Zimbabwe administration, and it's currently we are told it's under consideration. Our hope is that once that policy document is approved, it will also inform the policy for the African Health Digital Repository. So in terms of policy formulation, policy for the repository, that's where we are. In terms of implementation, we have managed to, for the purpose of particularly sensitizing because in this project, we are working in collaboration with the Ministry of Health, and the concept of institutional repository was a novelty to them. So while we're in the process of acquiring the necessary hardware resources, particularly the server, we installed the DSpace instance on a virtual machine, and we made it accessible to the Ministry of Education, Ministry of Health staff, and we managed to do some training on that particular instance. I'm happy to report that we managed to acquire the necessary hardware, the server, and so far we have installed the DSpace instance on the actual hardware server, and it's also accessible, notwithstanding our intermittent problem with our service provider. Like I have indicated, we are working in collaboration with the Ministry of Health. We are represented by Mrs. Nkint. Then in terms of ingestion of the material, currently we are still having some challenges vis-a-vis the issue of acquiring the ABI fine reader for OCR. It's those problems that we are experiencing at country level, because the ABI fine reader has to be acquired outside the country. So in terms of remittance of foreign currency, understandably so, the government is in the process of actually prioritizing because we've got limited forex reserves. So in terms of software payments, regrettably, it's at the lowest end of the priority list. So in terms of acquiring Fine Reader, for the amount is about $160, but we are having challenges remitting the $160 for the Fine Reader. So actually, that is a challenge in terms of going forward in terms of uploading the necessary, because most of our documents, they are already available in hard format, so we have to do retro conversion, and that's one outstanding issue that we. But I'm happy to report that the last time we left, we were told that all the necessary documents have been furnished to the Reserve Bank, and they were in the process of seeing if they can go ahead and ensure that that payment is done. And once the payment is done, this is a software license. It's a question of being given the key, then we can proceed with the retro conversion process. And the way we are doing the project, we have the Ministry of Health stationed at their offices, and the College of the Medical School, we call it the College of Health Sciences. So the input, the ingestion of the documents will be done at 2 centers, and we are going to make use of the DSpace's workflow functionality to ensure that all the documents, because when we had, as you will see later, when we were handing over the equipment to the Ministry of Health, one of the issues that was raised by the then Minister of Health was the fact that the documents that are available on the repository have been put by the Ministry of Health as well as the other universities. People are going to rely heavily on those documents. So there's need to ensure that the quality control measures are in place. But someone might rely on the documents that are there, on the information that is there, and prescribe, for instance, the wrong treatment. So in terms of quality control, I think it's one of those things that we have to ensure that before a document is made available on the Life Archive, it has been at least okayed by the librarian to just authenticate the source of that particular document. Then in terms of system maintenance, the way the library is set up, we do have a dedicated library IT staff that is resident in the library. But this library IT unit is also answerable to the Director Computer Center. So in terms of support from an IT perspective, the library is inherent support because of the presence of the library IT unit in the library structures. And also we have installed a number of DSpace instances, both at the University of Zimbabwe. The articles that we are putting on the institutional repository are those that are scholarly in nature. So any articles, for instance, newspaper cuttings to do with the university, but they are not academic, they are deemed to be less academic, they are not put on the institutional repository. Because our institutional repository is defined as an open access repository of scholarly content that has been produced by the University of Zimbabwe. So those documents, they find their way into what we call the digital collection, where anything that could be pertinent to the University of Zimbabwe, but that is not scholarly, is put. Then we also have a collection for digital maps. We have the geography department. They've got over 20,000 maps that have been produced over the years. But instead of students going to access the maps, we have decided to digitize the maps so that they are accessible, but on the intranet. So we have a number of DSpace instances that are running, and the ADHL project is just going to add to the tally of the institutional repositories that we are actually managing. So efforts will be made to ensure that all the repositories will be running on the latest stable version of DSpace. And in terms of disaster preparedness, we have the necessary scripts to ensure that routine backups are done. And as you will see, like I've indicated that currently our DHL repository is not accessible, but we have managed to get just the latest backup, and we have installed on one of the virtual machines that is running on the laptop. So that in a way it has shown that the backup is in good order. Okay, I've spoken about the collaboration between library and the IT. In our case, the collaboration is inherent because the presence of the IT representative unity in the which is part and parcel of the library, and is also part and parcel of the library administration, and in this case is also involved in this particular project. So in terms of the support, because of that presence of library IT unit is inherent in the setup. Okay, this is some picture. The project involves purchasing some hardware resources, and mainly to empower our Ministry of Health. So we managed to buy a server, some 2 desktop, a scanner, and 2 laptops. So this is why it was a handover ceremony of the equipment to the Ministry of Health. And I'm not sure if it is clear there. We have the then Minister of Health, Dr. Kenyatta, on the far left. Then we've got our PVC, Professor Mashiri, representing the University of Zimbabwe, handing over the laptop as a representation. Then we have our esteemed librarian, Ms. Chikonzo, as well as Ms. Ngindi. So I think all the our administrative member of staff, they were present. In terms of current status of the projects, because of the previous presentation, I might have to say we have made some modest progress in our project. The content for the various communities have been identified. Like I have indicated, we still have issues with the Abi Fine Reader for the OCR to ensure that the retro-conversion process can kickstart. Currently, our server is hosted on the University of Zimbabwe, but like I've indicated, we need to neutralize the URL. So the plans are at an advanced stage to ensure that the server is hosted and the URL is changed to represent Ministry of Health child care, to ensure that at least we can have a number of university/institution contributing content to the repository. Then I think we have a number of challenges that we are encountered, particularly those that relates to remittance of funds to our international suppliers, and even the purchase of our the server and the scanner. I think we had some challenges, but eventually we managed to get over them.